Breath holding spells are common in infants and toddlers and are often mistaken for seizures. Let's learn how to differentiate cyanotic breath holding spell, pallid breath holding spell, and true seizures from one another. So, starting off with cyanotic breath holding spell, it is common in infants of the age 6 months to 2 years. And usually, the trigger for cyanotic breath holding spell is when the infant is crying or frustrated. And so, what happens exactly is that the child cries, he takes a breath, so he exhales, and then he stops breathing. And that's when the child turns blue. So, this might also be associated with a brief loss of consciousness, and however, the most important thing to remember is that there is rapid return to baseline. So there is no post-ictal confusion or anything. The episode resolves spontaneously. Then there is pallid breath holding spell. This also happens in infants of the age 6 months to 2 years, and the trigger for this is a minor trauma, pain, or fear. So, in this, what happens is that there is a vagal response to the trauma, fear, or pain, and the child becomes bradycardic and pale, and there might be loss of consciousness as well, which is brief. And there's also like a brief state of post-ictal confusion or sleepiness, but it lasts less than 5 minutes. Then we have seizures. So, seizures can happen at any age. The trigger for this is that it's often unprovoked. Sometimes sleep deprivation can provoke a seizure, and the features for a seizure are that there might be tonic-clonic movements, there might be tongue biting, urinary incontinence, and most importantly, there is post-ictal confusion. This post-ictal confusion lasts more than 5 minutes. So that's how you differentiate it from pallid breath holding spell. And it's also important to remember that both cyanotic breath holding spell and pallid breath holding spell, they are more common in patients with iron deficiency anemia. So you have to evaluate infants for iron deficiency anemia. So pallid breath holding spell and cyanotic breath holding spell, they are benign causes, and they're self-limited, but a seizure requires further evaluation. So most of the time for a breath holding spell, you usually just do reassurance and no further testing is required. And sometimes you might need assessment for iron deficiency anemia as well, in iron deficient patients, if and they also experience improvement as well in the breath holding spell frequency with iron therapy as well.